Test every case. The World Health Organization says it's crucial in the fight against the coronavirus pandemic. But only a few countries are conducting widespread testing. So what are the challenges and how can they be overcome? This is Inside Story. Hello and welcome to the programme. I'm Bernard Smith. Isolate, test and trace. That's the urgent message from the World Health Organization to combat the coronavirus pandemic. Many countries have imposed mass lockdowns and ordered people to stay home, but few have implemented widespread testing. Many European countries and states in the US, for example, are limiting tests for only the most critical of cases. We'll bring in our guests in a moment. First, Priyanka Gupta explains why this could spell disaster.
After COVID-19 first emerged in China, governments around the world face two staggering challenges. First, to contain its spread, and second, detecting people who have it.
Isolate, test, treat, and trace.
The World Health Organization says the most effective way to fight the pandemic is to test every suspected case. The world is not manufacturing testing kits and lab supplies fast enough to keep up with the rising demand.
About 20% of people that have the virus don't show any symptoms at all, and these people are responsible for probably half of the cases that are out there. So it's very important that we ramp up testing. The difficulty right now is that the reagents that are used, the supplies that are used for testing are running very short all around the world. So there are shortages of swabs.
In many countries, health workers are depending on what's called triage questions to prioritize those who should be tested. That includes travel history, contact with an infected person, pre-existing conditions like diabetes, heart disease, among others, and symptoms.
If you don't aggressively test and isolate people, as has Singapore and Taiwan and other East Asian countries, you build up a critical pool of people who are carrying the virus, and then it's no longer possible to contain it. You can only delay infection, you can't stop it. And unfortunately, Italy has got to that critical point.
Countries such as China and South Korea raced to develop rapid testing kits early on. South Korea was one of the first to set up makeshift drive-through centers in and around the country. Thousands of people are being tested every day, while many countries like the UK are having to ration their testing supplies. At a time when tens of millions of people are under lockdown, the push to test as many people as possible has never been more urgent. Priyanka Gupta, Al Jazeera.
We spoke to a sports journalist who developed flu-like symptoms after contact with someone in Amsterdam who later tested positive for coronavirus. Now take a listen to what his experience has been like since returning home to Belgium.
At the start of the month, I went to the UEFA Congress in Amsterdam, a meeting of European football officials. There I met Kotso Tashima, an official for the Olympic Games in Tokyo. Last Tuesday he tested positive for the coronavirus. So the next day I went into self-isolation, the same day that the Belgian government here imposed a strict lockdown. I had been feeling sick for a number of days. I called my doctor and I demanded to be tested. Unfortunately, that test was refused. In Belgium, only medical personnel and those persons with very severe symptoms of the virus get tested, which means that in reality very few people get tested. I was told to stay at home and self-isolate, which I did. I live at home with my mom. She is 60, so that brings added anxiety and practical problems. And so every time you cough, you wonder, have I contracted the virus? Luckily, I am feeling better now after 6 days of self-isolation. But in reality, even though the government last week reportedly acquired another 100,000 test kits, in reality, we will never really know if I had the virus or not.
Let's bring in our panel. In Hong Kong, Dr. Arisina Ma, she's the president of the Hong Kong Public Doctors Association. In Singapore, Ying he's the dean at the Swee Hock School of Public Health at the National University of Singapore. And in Cambridge, Massachusetts, in the US, Dr. Ingrid Katz, she's the assistant faculty director of the Harvard Global Health Institute. Welcome to you all, and thanks for joining us. Arisina Ma, first of all, I know we have to ask you this. You have, at the moment, treating people with the coronavirus. How is that? How challenging is that for you?
Actually, in Hong Kong, we have rapidly increasing number of confirmed cases. We are get our first confirmed cases in early February, much earlier than the rest of the world, because that is the cases imported from mainland. However, we can keep the number growing very, very slowly for a long while. Till recently, all those arresting countries get their outbreak, and some Hong Kong people who stay in those foreign countries return back to Hong Kong, and we have a rapid rise of confirmed cases. We have much more number of imported cases, and also start to have some local infected cases. But the hospital, the isolation facilities are almost full. But most of the cases are quite well because they are young, they have good past health. But we worry that if the disease start to spread through in the local setting, and the elderly and patients with chronic illness get infected, they will be in a much poorer situation. We have 4 cases died in Hong Kong in these 2 months. All of them are elderly and also with chronic illness.
Okay, Ying in Singapore, what has Singapore done that it's been able to keep a lid on this outbreak? What is it doing correctly with testing?
Well, I think what we've been doing is really to try and find the cases when they occur and very quickly contact trace who are the people that have been in contact with this group of people that have been confirmed cases. Once we find the contacts, we actually isolate them, we quarantine them very quickly, and this removes the high-risk group of people within the community to reduce any onward transmission. And equally, we identify what are the next importation risks. We very quickly identify and put in place the necessary importation travel advisory measures and travel bans to limit the importation risk. So I believe these are the 2 measures that have helped to keep community transmission within Singapore to a manageable number.
Ingrid Katz, is it frustrating to listen how they're doing it in Singapore and Hong Kong, knowing that in the US, this is not what's happening?
Both Hong Kong and Singapore have done exceptional jobs. Contact tracing is absolutely critical at this time. And I think, unfortunately, the United States just fell so far behind with the lack of testing that even successful contact tracing measures are not effective if we don't know who is indeed infected.
So, Ingrid, is it too late to start testing in the US? Has that opportunity gone?
No, it absolutely is not too late. Yeah, I mean, I think it's absolutely clear that we need to ramp up testing incredibly quickly, and certainly people are focusing on that right now, but it's not too late. We need to get a better handle on the numbers that we're talking about. Right now in the United States, we've run about, I think, around 103,000 tests. And again, because those are high-risk people that have been tested, those numbers, the actual positivity rate has been high. About a third has been about a third has been positive. However, we're not testing. We have not been able to test people who were either low symptomatic or possible contacts of people at high risk. So we are woefully behind, but it's not too late to catch up.
Ying again, do you think for countries like the United Kingdom, for France, for Italy, for Spain, it's too late for them to copy the Singapore model?
I think it's important to bear it in the perspective that even in a country like the United Kingdom, there are regions where there is no widespread community transmission at the moment. There are sporadic cases, there are some clusters, and those are the perfect situation where active contact tracing, active isolation will help to keep the numbers down. So we have to look at a country and really take a stratified approach to see which are the measures that can be put in place in regions where you can manage the contact tracing load versus those regions where it seems to be unmanageable and you have to find alternative ways. Perhaps a lockdown mechanism may be put in place when there is a widespread community transmission where contact tracing will no longer be manageable. But I have to emphasize that testing is imperative. We must continue testing to know who have been infected and to take the right measures to isolate those that have been infected away from the community.
And Arisina, in Hong Kong, how important was testing and has testing been to keep a control of the spread of the virus?
Actually, at the beginning, since we provide tests to almost every person who has a travel history and also certain kind of symptoms. So actually, we can identify some very mild cases. And also, after we identify some mild cases or some confirmed cases, we keep their families member in some quarantine area, keep the members who have close contact with them in some more quarantine areas, and then providing them tests once they got even mild symptoms. So we have caught quite a number of cases in a very early stage of the disease, and they got start treatment early, they are detained early, so it didn't have a right community spread. From the latest stage, we actually expand our testing system. Actually, for all in recent days, we almost test all of the people who returned from Western country who present with even some mild cough. And actually, our government just announced today, actually, they're going to test all people who are returning from European country or North America, even you have symptom or not. I have talked with the hospital authority, one of the local authority who is responsible for the testing. Seems that we still have enough kits and equipment to do the testing, so they plan to do as much as possible. Try to detain all those infected cases in certain area, because Hong Kong, like some other Asian country, we are highly dense populated. So we can't just let those confirmed cases walk around in the society because it is a highly contagious disease.
Ying, Singapore is a society well used to government regulation. How important is it to have public buy-in to what the government wants to do to try and control the spread of this virus?
I think it is absolutely important to get the public's buy-in, because at the heart of it, COVID-19 is about the people's response to government measures to try and protect themselves. For example, in Singapore, we have a hybrid approach between active testing and actually isolation of individuals that are high risk. So I hear that the Hong Kong response is to test everyone that is coming back from Europe and from America. Those are the new epicenters of the disease. But in Singapore, what we do is that we don't start off testing everyone, but instead we put all returning travelers into Singapore on a 14-day stay-at-home notice. It is mandatory, it is legislated. If you flout the laws, you could be prosecuted. But along those lines, there is actually the personal responsibility that individuals will take to stay away from large crowds until they themselves are very clear that they are free from the disease, and that takes 14 days of self-isolation at home or in a hostel if you are one of the migrant workforce.
Ingrid, the US and Western European countries are culturally different in their relationship between the government and the people. Is it going to be difficult to get the citizens of the US to buy in like they have done in Singapore and other Asian societies?
Yeah, I'm listening to your other speakers here, and I am I have to say that this is going to be a challenge in the United States. It's certainly a very grave situation. And because it's really being run at a state level right now, I do think that different states are responding differently. Here in Massachusetts, while there has not been a full lockdown yet, people are absolutely requested and really required to go into self-isolation if they have any symptoms or have been in high-risk contact. That said, as many people have seen in videos circulating, there's still people who are not taking this seriously, are going off to various spring break destinations in large groups. And I don't think that the message has been consistently conveyed across the country. And there is a lot of misinformation, unfortunately, that people seem to be holding on to, that this is not a grave situation. And that's absolutely incorrect. And I do think that people who are really struggling with physical isolation right now need to really be listening to these messages. We can absolutely see the data from Singapore and Hong Kong and other countries that have been able to get this under control. We need to be following that absolutely strict policy, even though this is going to be hard for a lot of Americans.
Ingrid, though, do you see this snowballing towards the United States? When you look at the US from outside, it looks like something's coming and they're not ready.
Yeah, absolutely. I think that is certainly the fear. I'm also a physician, and I think in speaking with a lot of my colleagues, I do think that people are very fearful right now, that people are not taking this seriously. And as has been widely reported, there is a large-scale shortage of personal protective equipment, which means that healthcare workers are putting their lives on the line if they're not adequately protected. And we've already seen cases, certainly in healthcare providers, and deaths globally. And so we have to be vigilant. I think people are really feeling like they're seeing the tip of the iceberg and they're steering the ship towards it. And it's not clear what's lying underneath the water. And that's a deeply concerning feeling.
Ying, there are parts of the world where there are not major outbreaks yet. There are parts of Latin and South America and parts of Africa where the coronavirus is there but not spreading widely. Is there chance for those countries to sort of implement the testing you are suggesting to halt the spread of the virus in those places? Is it too late for them, or is there time?
There is definitely time, because for many of those countries, they are starting to see sporadic cases or perhaps clusters that are emerging. And those are the situations where if you have the capacity to test, and I'll come to the capacity in a moment, if you have the capacity to test, you should actively test and put in place a rigorous approach to contact trace. This will take unprecedented coordination within the countries. Many of these countries will require assistance, global assistance, that to help them with the testing and also to scale up the healthcare workers' capability, knowledge on the use of PPE, and even the knowledge on administering the intensive care management that is necessary for the treatment. But if we are able to capture the spread much earlier on, actually that will help a lot of these countries manage their situation in the local setting. We allow the setting to continue to spread beyond the situation of sporadic clusters to widespread community transmission. That is something that we, as a global community, will have to contribute to help these countries against that.
Ingrid, can I ask, what happens when you pass the point of it making no sense to lock down specific areas, when the virus is so widespread? What do you do then?
Well, I think, first of all, you have to have a good sense of how widespread it is. So testing is still absolutely critical. And also eventually having a serology-based test so we can really understand who has been exposed to the virus and has antibodies. I think we're not at a point at all where self-isolation is not necessary. I think that even in communities that are very heavily hit right now, New York City is absolutely getting decimated by this because people live in very close proximity to each other. people still need to self-isolate, to physically distance themselves from people. And I think this is very hard for people, particularly in densely populated urban areas. And we need to be looking to our fellow global citizens in Asia who have managed to do this even in densely populated cities. So at this point, I don't see it should not be a loosening. If anything, there needs to be a tightening of isolation between people at this point.
Arisina in Hong Kong, how are you testing people for antibodies to show that they've recovered from the virus? Or if that's possible, how useful would that be for an organisation like yours?
Actually, we do have around 100 patients get recovered and discharged from the hospital. I know that the university has tested antibody level, but we have not, like mainland, we have not tried to extract the antibody and get it used in the clinical setting, help the others to recover from the disease. We are still under the study. I think, first of all, we need to know that how long will those recovered patients will have the antibody will last for. For the SARS patient, it will last for 2 years or so. For the MERS patient, they only last for like 10 months. But how about for this new nCoV virus? Will it be even shorter? And whether get the antibody from the recovered patient and inject it to the sick patient, will it going to help them to deal with the disease is still unknown, though mainland said that it is useful. I just want to supplement about the quarantine procedure and everything. In Hong Kong, similar to Singapore, we do ask all those return from high-risk area to have quarantine or medical surveillance for 14 days. But we do see that sometimes people do not follow the quarantine or the surveillance well. We see some cases they sneak around and so on. That's why one of the reasons why the government just implement to test all those returned from the Western countries to make sure that even they break the order, we still know that whether they're infected or they try to infect someone else or not.
Okay, and Ying again, what are the risks of the coronavirus appearing again in countries that think they've got a lid on it?
I think the reality which the world is facing right now is very clear, that we have to help every country manage the problems before the world can declare to be completely free from the disease. If we just look at the situation in China, and I want to highlight what China has done, has successfully removed the case of local widespread transmission down to 0 cases, 0 domestic transmission in China. And that has shown the world that this is a disease that can be contained with the right measures. But equally, as China relaxes its controls, we are starting to see a second wave coming in from importations. So talking about countries, individual countries keeping a lid on this, I don't think that is a realistic scenario as long as there are epicenters happening in other parts of the world, be it in Europe, be it in America. So we really have to look at helping all countries in the world manage this problem properly. Otherwise, we will see a prolonged drag of this disease across the world.
Ingrid, would you, those sort of sentiments, very quickly, we're running out of time, but those sort of sentiments you would echo, I guess?
I think the more that we stay in front of this, particularly in low resource settings where healthcare infrastructure and systems may not be as strong and certainly not be able to absorb the impact of a large scale pandemic, we have to stay in front of this. We have to get serious about these measures globally. And citizens who haven't been taking this seriously need to have an about face. At this point, there really is no other way. There are measures, there are classic public health measures that we can use to contain the spread of this virus, but people have to be exercising them. Otherwise, this will not be effective.
All right, thank you very much. We have unfortunately run out of time, but your insights have been very, very important. So thanks to all our guests, Dr. Arisina Ma, Ying and Dr. Ingrid Katz. And thank you too for watching. You can see the programme again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Bernard Smith, and the entire team here in Doha, bye for now.